I felt this tremendous crushing pain in my chest and pain in my arm, and finally got to the rental car and sat down, and it sort of went away. Got home on a Thursday, and on a Sunday I started to get that pain again. And my daughter said, Winchester Hospital for you. And in the car I went. Before I knew what was going on, I was in a gown, I was on the bed. I had an ECG, I had an intravenous, and it all went from there. And the interesting part about the Winchester staff is they not only listen to you, but they hear what you're saying.
You're with the patient. You know everything that there is to know about the patient. You know, you do your whole assessments yourself, you do your whole documentation yourself, and everything is done by you, the nurse. A lot of places don't have the BiPAP machines. They're multi-million-dollar machines. We have a state-of-the-art call bell system as well. So if a patient rings, that goes right to my phone.
And the whole emphasis of the staff is on the patient and what the patient's feeling, what they're thinking, what the family's feeling, and how the family is reacting. You know, this whole package is very important to the staff in this hospital.
I think it's all about bringing care closer to home. I think that people want to be treated in their own community. They don't want to have to travel the distance to the city. They don't want to have to pay the parking. They don't want to have to be gone all day. They want a short trip for their treatment and back home to rest and be with their family. So I think that's really what's driven the care that we provide, bringing it closer to home.
So he said, we'd like to offer you 6 months of chemo, and I said, let's do it. I said, that sounds good to me. You know, you're talking about 6 months, so you're not saying there's nothing we can try. And we were in chemo within a couple of weeks. I would never even let myself go there to think you could be cancer-free. I'm thinking, you know, if I have it a year, or, you know, like, we'll just take it a day at a time.
For me, the most fulfilling part is helping women through their breast cancer diagnosis, and it's not just myself; it's the nurses, it's my office staff. You know, we support them through it. We get them through the surgery. We get them through the surgery and into the operating room in a much quicker fashion than they would elsewhere.
We're a satellite unit, so that the care they get in the satellite unit is exactly the same as what they would get if they had gone to the city. We've all been trained by the staff at the Ottawa Hospital Regional Cancer Centre, so the care is exactly the same.
It's just on such a more personal level here that, you know, and I have dealt with big hospitals, but it's not the same. It is truly not the same as dealing with a smaller environment where you know people, and the comfort level is just completely different.
They would much rather come here versus go to some of the bigger hospitals in the city, just because it's a smaller place where people are more personable, and the wait times are shorter.
Oftentimes people's financial situations change, and they just don't have the cash that they were used to having, so it's they welcome coming to a place and getting the same type of care that they would get somewhere else and not have that financial burden. Plus the fact that it takes a lot of stress off these people. They're under a tremendous amount of stress when they are faced with a life-altering disease, and anything that we can do to eliminate or at least alleviate some of that stress, they welcome that kind of care and that type of atmosphere that we can offer them.
Just being in Ottawa and saying, well, I do surgery in Winchester, the first question is, where's Winchester? You know, even though we're just like 30 minutes drive, you know. And so when they come here, they come back and say, wow, I didn't know there was such an hospital out there. The nurses attended to me well. I was very welcoming. The hospital is so clean. You know, my room, it's almost like they didn't expect something like that, you know. Yeah, there's a big misconception, like maybe rural means less, but no, it doesn't.
Now with the CT scanner, we can do a lot more tests here on site instead of sending people to Ottawa for CT scans. And with the new technology, we get more complicated patients. We are now drawing a lot of patients from all around the area to come here.
I've been at the hospital for 25 years. It's hard to imagine when you look back. I don't think many people are aware of maybe what we can offer to them because we aren't a larger center. I think the rule of thumb or the thought process behind it when you become pregnant is that I need to be in a large center where they can absolutely offer me everything that I might require, not knowing that in fact we do and can offer all of the same services for them that they can at a larger center.
We came for a tour, and we were very well received. It's a very beautiful hospital. Although it's a bit of a drive, this is where we wanted our son born.
The nursing staff is so attentive that just one call bell and they were like in a single second, they were there.
One of the things right out that the nurse said is that, after you have the baby, if you feel you need another couple days, you feel you need any more help, by all means let us know and we'll let you stay, which was comforting. It wasn't like we're going to have the baby and then, okay, we need the bed, see you later. It wasn't anything like that. They really made us feel like, we're here as long as you need us. And that made me feel real good.
I'm honored actually to be there at the birth of your baby. I'm there as an advocate for you. I'm your nurse. I'm there to advocate what you want during this labor and delivery experience so that at the end of it, you're proud of the experience that you had and you're happy with it. You have a beautiful newborn baby at the end of it.
Well, we just want to thank Winchester Hospital, the doctors and nurses, for everything that they did. They made us feel very welcome, best of care, and we walked out the front door extremely happy.
I think people have to understand that there are hospitals today that still care about the patient.
I think it is quality of care that brings people to our neck of the woods. It's a great little hospital. It's got lots to offer.
We're the best kept secret, really. The more we're known, the more we'll see, and people start to appreciate coming here for you're treated like a person. You're treated with respect, and you're treated in a much more timely fashion than a lot of times access to care in the city.